Hi everyone, it's Derek here from Adu-Med. In today's video, we'll take a look at shoulder pain. We'll think about the different causes and how we assess and manage these patients. Now, I think a really good way to start this all off is by having a think about our shoulder anatomy. So, in our patients that present to us with acromioclavicular joint pain, these patients have pain localized to this joint, in addition to a few more things, including discomfort at the high point of the shoulder arc, which is basically when the arms are lifted above shoulder level. And in addition to this, we'll have a positive scarf test, which is basically when pain is elicited with a flexed arm, which is adducted across the body. With pain coming from the glenohumeral joint, our patients may have reduced passive external rotation. And also in our rotator cuff issues, our patients will have a painful arc. Also make sure that you're aware of any history of dislocation, as this is also important. Let's now take a look at all our conditions in a bit more detail. In rotator cuff disorders, our patients will usually experience pain at the top of the shoulder and the lateral aspect of the shoulder, and this typically gets worse on raising up the arm. Our patients usually have a history of repetitive movements at shoulder level. This is why it's really important to be aware of the patient's circumstances and take a really good occupational history. Active movements can be painful and restricted. Now with passive movements, although they're painful, remember that the patient will still have a full range of movement with passive movements. This is important to consider when we examine the patient. Also, these patients will usually have a painful arc of abduction between 70 to 120 degrees. When we assess these patients, we can arrange further investigations, which may include an ultrasound scan to confirm the diagnosis. Primary care management includes rest, analgesia, steroid injections, and physiotherapy. Let's move on and think about frozen shoulder. Now, this condition is more commonly seen in our patients with a history of diabetes. These patients will have a gradual onset of pain and stiffness, usually around the deltoid muscle. So there are three overlapping phases in frozen shoulder. Firstly, the painful stage. This lasts 2 to 9 months. The stiffness stage. This usually lasts between 4 and 12 months. And lastly, the resolution stage, in which we see a gradual improvement over a 12 to 24 month period. On examination, these patients have a globally reduced range of movement of the shoulder, in addition to reduced passive external rotation of the shoulder. Our management options here include simple analgesia, referral for physiotherapy, or corticosteroid injections. Our acromioclavicular joint disorders may either be due to osteoarthritis or a previous history of joint injuries. Now, as previously discussed, pain in the shoulder can be brought on by lifting the arm above the shoulder and also by putting the arm, which is flexed, across the body. Looking at our glenohumeral joint disorders, remember that on examination, these patients have a reduced active and passive movement globally with loss of passive external rotation. Treatment includes rest, analgesia, and the use of steroid injections. Thinking about other conditions that can cause shoulder pain, let's think about our shoulder dislocations. Now, patients that have shoulder dislocations usually come with a pretty clear description of what happened. We commonly see shoulder dislocations in our patients aged between the ages of 10 and 35. With those who have a history of trauma or an atraumatic shoulder dislocation that has not responded to treatment, we need to consider a referral onwards to orthopedics. Thanks for watching today's video. We've taken a look at some of the common causes of shoulder problems. If you found it helpful, don't forget to leave a like and subscribe. Also, make sure you check out our musculoskeletal playlist, which has a lot more videos on this topic area. Until the next time, I'll see you soon.